Hello everyone, Dr. Tom Chaney here from Living Health Integrative Medicine in Annapolis, and in this video I want to go over some of the common side effects from metformin. So we see that metformin is the most commonly prescribed type 2 diabetic drug on the market, and this is the one that's usually prescribed first and the one I see patients coming into my office taking most frequently. So let's talk about what are some of the common side effects. Before I do that, let's talk about where metformin works. And we see it typically addresses three things. It helps with insulin sensitivity. It does help with the liver. It works on the liver, so it's not releasing sugar. And it also works at the gastrointestinal tract, so that there's less absorption of glucose. So those are the three primary areas that it's working on. Let's talk about exactly what happens most commonly as far as side effects from metformin. So the most common complaint I hear from type 2 diabetics coming to my office is that GI upset. So intestinal upset, stomach upset, that is number one by far the most common complaint. But here's the list, and these are some of the common issues: unusual muscle pain, feeling cold, trouble breathing, feeling dizzy, lightheaded, tired, or very weak. Once again, I mentioned this one, the stomach pain, even vomiting, slow or irregular heartbeat. So these are all things that if you have any of these, you really need to reach out to your doctor and talk to them. And then here are some of the more common ones: low blood sugar. So it's important that you're staying on top of your blood sugar. You're checking your blood sugar whenever you're on these blood sugar lowering medications to make sure they're not going too low. Fasting blood sugar, a normal range would be 85 to 100. That's ideal, keeping it in that range. So low blood sugar is a common side effect. We talked about the stomach upset and diarrhea. So those are the two most common that I hear patients complaining about. Sometimes that can be resolved if you're taking this with food. That can sometimes help. Or the extended release can also provide some relief. I'm going to add another one to this list that I see is vitamin deficiencies. It's been shown in some of the research that this medication, when you're taking it for an extended period of time, it can deplete nutrients from the body. So B vitamins would be the most common nutrient deficiency that I see. And really, when you're taking a look at many of these medications that are on the market, that's one of the things you have to ask your doctor about is, does this medication, does it cause a depletion of any nutrient that I should be supplementing to kind of counteract? So that's an important one. So I hope you got some great information from this video. I just wanted to go through and talk about some of these common side effects. And if you're taking metformin, you definitely want to talk to your doctor about these. If you're having them, you want to discuss it, and maybe there's an alternative for you. If you want more information on how we approach type 2 diabetes, we approach it in a holistic manner. We want to address the root causes and help patients reverse this disease in a very systematic way and in a healthy way. Check out my training. It's my Diabetes Solutions training. I'm going to put the link in the description down below, and then you can click on that free training, get more information on what we do and how we do it. And if you like this video, just hit the like button, share it with friends and family, and I look forward to seeing you in the next video.